Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and on the podcast today, we're going to talk about managing your thyroid because your thyroid levels are not static. So often when people with thyroid, start over again. Hey, this is Doc Yates, and on the Simply Health podcast today, we're going to talk about how your thyroid levels are not static and 4 important things you need to consider in terms of managing and maintaining a healthy thyroid. Now, this is more specifically for people who are already on thyroid medication or on the verge of needing to, and some of the changes that can push you to that shift. So maintaining a healthy thyroid through these different shifts and times of your life are key, because unfortunately what happens generally is that you're given medication and that's often it. Like maybe you get checked once a year, or you say to your doctor, I know I'm on this thyroid medication, but I still have all these symptoms of low thyroid. They check it. They look at the test. They don't really tell you anything. They say everything is okay, and then it's not that, and therefore you're fine. So let me tell you what I've actually found in practice when working with people and dealing with people and testing them as they're going through these changes. Number one, this is something that is very well known, but a major factor that can change your thyroid levels is pregnancy. So during pregnancy, you should be checking your thyroid levels pretty frequently, because low iodine and low T4 can lead to detrimental changes with the fetus and with the baby. So you want to make sure that you're getting the thyroid checked on a regular basis when you're going in for your blood checks, and make sure that you're maintaining not just the TSH. It's, again, I feel like I've beat this drum so many times. When you're checking the thyroid, always check the full panel. TSH, T4, T3, because it's so common that you see TSH completely normal and T4 and T3 way off. So it's always good to check them both. Or when I say both, all of them, all 3 of them. So pregnancy can definitely shift it, and not just during pregnancy, after pregnancy. The after pregnancy is a time where it's very common for the thyroid levels to drop for females, and they're tired. Everyone's like, oh, it's just you got a new baby, you can expect to be tired, your sleep is off, you can expect to be tired. And yeah, definitely a new baby is probably one of the most exhausting things. But putting all your eggs in that one basket and then turning a blind eye to anything else it could be is a bad idea. And thyroid is one of those things that it often is. And I saw a case of that probably about a month and a half ago. Someone came in, and same thing, they're exhausted, and I'm like, well, you do have a newborn. They're like, well, actually the baby sleeps pretty well, and we're able to sleep pretty well. And I'm thinking, oh, I wish that was the case for when my son was little, because he was a terrible sleeper. But not to go away onto that, we looked into the thyroid, and lo and behold, her TSH was great, but her T3 levels were bottomed out terrible. So we were able to actually do something without having to give her a hormone, just to improve her conversion from T4 to T3, and then of course she started feeling a lot better. The next big change in your life, and this is who this podcast is geared towards, of course, but is perimenopause. When your progesterone levels start shifting and then your estrogen levels start shifting, it's really common that you also see your thyroid levels start to drop. And generally what I find, and I haven't seen a lot of studies to back this up, but what I find is that TSH is often normal. For a lot of people, the T3 is pretty good, but their T4 levels really start to drop off. And these are cases where the first thing I like to do is use things like thyroid support herbs, extra iodine, and added selenium into the diet. And that, when you do that and then you're able to balance the progesterone levels back, you typically see thyroid levels improve. Now, at the same time, if someone's already on thyroid hormone and it's T4, like a Synthroid, it's not uncommon that they need to increase their dose around that time when you're going through perimenopause. So be aware of checking your doses during the times you're going through hormonal changes. The next thing that really leads to an increased demand on your thyroid is stress. When your body is undergoing stress, it doesn't just affect the adrenals, because the effect of cortisol and your adrenals on your thyroid, like those things are linked together like Siamese twins. Like if one goes off, it's going to play a role on the other. So sometimes the high stress can just downgrade your body's ability to produce T4. Sometimes it reduces your body's ability to convert T4 into the more active T3, so you're not getting the energy and metabolism. And the worst case scenario is sometimes you'll see an uptick of something that's called reverse T3. And this is the worst case scenario, because in those situations, reverse T3 doesn't just block your receptors for your thyroid or make it so that the other ones are not working as well. It blocks them so well that even if you do have any T4, you're not getting any of the effect into the body. Reverse T3 is the worst case scenario. So it's always, when someone's undergoing a lot of stress, and if I generally, on a regular, consistent basis, I don't check T3. It's an added expense, and it's pretty rare that it's elevated. But if someone's telling me, you know what, I'm taking thyroid hormone, I've been under a lot of stress, things feel different, that would be the situation where I'm going to recheck their thyroid and check reverse T3 and see if there's anything else that is off. And if reverse T3 is off, that's a situation where you do need to use specifically T3 as a treatment. But I can discuss that a lot more in another podcast. So the point is, if you're under a lot of stress, make sure that you're getting your thyroid levels rechecked during that time. And if you do bump your thyroid levels up, if you're taking thyroid hormone, and if you're bumping it up during that period of stress, then all of a sudden, let's say that stress clears, you might want to be aware, because then as your thyroid demands decrease, you then might not need to stay on that high of a dose of thyroid medication. Then point number 4 of something that can reduce your effectiveness of your thyroid or your thyroid gland to work is if there's anything for deficiencies. So generally speaking, you can see changes like this when someone's been on a diet for a longer period of time and they're deficient in things like iodine. A classic example of this would be that there's been a long time where people have considered salt to be really bad for you. They're like, oh, you can't have salt, it's bad for you. It's bad for your heart. And this is not true. Like excessive amounts, especially when people are doing a lot of processed foods, those are all bad for you. So what was happening is that we're getting people they're switching away. They're not doing processed food, which is great. But then at that point, they're eating their vegetables and their lean meats, etc. But then they're not getting any extra salt in their diet. And they're like, well, salt's in the food and you're getting lots of it. No, you're not. You're getting salt in all those processed foods. And the thing is, with that type of salt, it's a non-iodized salt. And I know there's different debates about iodized salt, etc. But the point is, it does still help, for at least with preventing deficiencies of iodine. So where I'm going with this, if you're not getting iodine in your diet, and you're not taking anything with iodine in it, and you're starting to see thyroid symptoms of low T4, but yet the TSH is pretty good, consider adding iodine to your diet. And selenium is another really important one. The big ones for the deficiencies are iodine, selenium, and the B vitamins. You have to make sure you're getting that. Tyrosine is always listed, but that is something, unless someone's a vegan, I do find that they generally get that pretty well in their diet. So I'm not as concerned about that one. So, and again, you're like, well, you know what? I just saw my doctor, and he said my thyroid was normal. So there you go. There you go, Doc Yates. You don't know what you're talking about. I would bet you should ask for a copy of those results. Because first of all, they probably just checked your TSH. And if you have a lot of thyroid symptoms, so say you're tired, not just tired, but there's weight gain, and you're going to sleep, and you're waking up, and you're still exhausted, and you're seeing changes, especially with like brittle nails, dry hair, make sure you recheck and insist that your practitioner is checking TSH, free T3, free T4, and go through those levels. And if those are all in the, not just within the range, like the big giant range, but they're within the ideal range, perfect, then at least you have one stone you've been checked under, and you can now go on to see what the next possibility could be. Because undoubtedly, there are a lot of things that can overlap, like hormone changes can mimic thyroid issues, adrenal issues, sleep deficiency can mimic it. You want to make sure you're always getting the full picture. But by getting the full picture, you have to be checking the thyroid properly and during times of change in your life. So I hope I drove that point home. I hope I was like kicking a dead horse over and over, beating the same drum over and over so that you'll get the point. Don't be satisfied just when someone looks at a lab quickly and says you're fine. It must be in your head. Deal with it. So this is Doc Yates reminding you thyroid is not static, and I'm signing off. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.